never mind the fact that his girlfriend Lindsey Vonn set a world record. It was Tiger Woods' missing tooth that grabbed the headlines last week. Maybe somebody didn't yell "4" soon enough. Well, damaged teeth is par for the course for our next guest, who can fix all kinds of dental issues, including replacing a permanent tooth with a new, stronger one. Tiger needs to make an appointment with the Texas Tooth Lady, also known as Dr. Terri Alani. Good morning.
Good morning.
Okay, so we can lose a permanent tooth in all kinds of ways. Disease, it can be knocked out. Tiger says that a camera accidentally bumped his tooth.
Crazy.
Yeah. But the good news today is that we can replace it with something that's better than what you had to begin with, really.
Exactly, and they can actually last a lifetime. So let's break it down, because a lot of patients really don't realize what an implant actually is.
Right, they're used to doing the dentures and things like that.
Exactly. So I brought some pictures. It's a replacement tooth root, and it's made out of titanium.
Wow. Which is not ever going to break down.
Exactly. And this is actually what is placed into the bone. And it's great for replacing one missing tooth or many missing teeth.
Yeah, okay, I got to ask you something right now.
Yes.
When we look at this right here, you say we place it into the bone. I know the first thing people think is this painful? But I know people who've gotten it done didn't feel a thing.
No, it's like having a tooth extracted. Same, similar thing. And you can, control it with minor pain medication after the procedure. But let's talk about what it's actually broken into. So you've got your post that's placed into the bone. Then you have the second piece that is actually, it's called the abutment, and it's actually cemented or screwed onto the top of this so the crown will fit on. So it's two parts.
Yeah, and that means it's really stable.
Exactly. And so most people don't realize that. So let's talk about what are the advantages of an implant. So an implant, Deborah, is great to replace that one missing tooth, so you don't have to alter the teeth on either side of the space. In this particular patient, this is part of the implant abutment, but we have a patient that we did not have to alter the teeth on either side of the space. What does that mean? That means you preserve healthy teeth, plus you're able to floss your teeth as you did before, and also it's very aesthetic. Yeah,
because you want to keep your teeth if you can.
Exactly, and they're very natural looking.
Okay, so there we go, right there. Yeah, and that's the other thing. When you make this implant, it is custom made to fit with the color of your teeth, the shape that it needs to fill.
Absolutely. And what you want to do is you want to get rid of these what we call flippers, these removable appliances, because they have adhesives. You don't have to wear an adhesive with an implant. You want something that's going to be permanent and it's going to last.
Yeah. Well, it works like your real teeth.
Exactly. So let's go ahead and talk about the procedure of an implant.
Okay.
What do you do? So first of all, you have to make sure that you have your team. I recommend for patients to go in and see their general dentist first. That's first and foremost. Don't see a specialist first. See your general dentist, because we're the ones that are the gatekeepers that actually have the team to assimilate to get this procedure done.
Because first you want to figure out also why that tooth is missing. Now, if it got knocked out, we understand that, but sometimes it's because of dental disease.
Well, the important is we're the restorative dentist, so we know exactly where that implant needs to be placed to get that ideal aesthetic look. So we're going to refer you to the specialist, and the specialist is going to take a 3D cone beam radiograph.
Okay.
And what that
radiograph,
Okay. What the radiograph is going to do is that's going to show you if you have enough bone. If you don't, they can now add bone. Then you're ready for it to have the implant placed. So this is before the doctor then goes ahead, the surgeon, and places the titanium post into the bone. And that's what it looks like from looking on at your gum. That's what it looks like, and there's nothing above the gum line.
Okay.
Not at all. This is just stays into the bone, and it has to heal for 3 months.
Okay.
So this section right here has to heal for 3 months, and you either will have a temporary or one of the flippers or something, because the bone has to integrate with the implant.
Right.
After 3 months,
that's what gives it stability.
Exactly. After 3 months, then you're going to go in and have your abutment either cemented or screwed on. Then you come see us, we take an impression, you get the crown made, and there it is.
Yeah, and it's the tooth that you wish you always had.
Exactly.
In many cases.
And they can last a lifetime. I mean, there is like 95% success rate. Now let me tell you who is a good candidate. Really, anyone that can have oral surgery or routine extraction is a good candidate, but if you have a chronic disease such as diabetes or high blood pressure, you need to be evaluated on an individual basis, because you want to make sure that the implant will hold and there won't be complications later. Now, you've got two types of abutments. You've got your titanium abutment, and then that's for the back teeth. And this is the end result.
Oh, wow, look at
you
that.
You can't tell.
Yeah.
And then in the front of the mouth, we have what we call a ceramic or zirconia abutment, which is tooth colored.
Right.
So when you actually put the restoration on, it looks just like your front tooth, and that's probably what Tiger Woods will have.
Yeah, yeah. Well, I got to tell you, my mom had a couple of implants put in, and she is so happy with it. She's like, I cannot believe she put it off for a long time.
Yes.
And her advice to anybody who's thinking about this, get it done. Don't put it off. It really impacts your quality of life. Usually people who are able to eat real food again.
Exactly. And when you go to see your dentist, make sure you let your dentist know that you have an implant. This is what it'll look like on an x-ray. There's a picture of what, let's go to the radiograph or the x-ray. Right there.
Okay.
That's what it will look like. And you want to make sure you tell the hygienist, because they are cleaned with a little bit different instruments than your natural teeth.
Okay, yeah, I just want to make sure. Okay, I got to ask you about this. We've heard a lot about get your teeth in one day.
Oh,
so,
yes.
Okay, teeth
and
in a day.
I'm going to do a segment on that.
Okay.
So let me tell you about the teeth in a day. Basically what it is, it's for people that have lost all their teeth. The dentist goes in and puts implants in, and they put a temporary appliance in. But here's the thing. They don't get the permanent one for after 6 months. But you will have temporary teeth. But you cannot eat anything hard for 6 months. You have to eat just soft foods, because what happens is you have to let that bone integrate with the implant. So that's what teeth in a day are. It's not really in a day, but you will leave with teeth.
All right, Dr. Alani, thank you very much. Dr. Alani has a special offer for new patients. If you come in for a new patient exam and cleaning for the next month, you'll receive complimentary x-rays from Dr. Alani's office, but you must mention Great Day Houston. For more information or to schedule an appointment, you can call 713-621-5141, 713-621-5141, or visit her online at TexasToothLady.com, and like her on Facebook at Facebook.com/Terri Alani DDS. Hey, don't forget to log on to Facebook.